Hello medicos. So as I have started the new series, that is instrument of orthopedic series. Today is part 1. We will be knowing about the instrument periosteum elevator, and next part 2 and slowly part 3 I will be telling about all about the orthopedic instruments. And let's start the periosteum elevator. Periosteum elevator is a instrument that is used in the orthopedic surgery. It has handle, thumb rest and cervical curve tip. And the past in the parts you can see that handle, it has a flat long for gripping. This is the handle part. Then thumb to rest, that is serrated and concave. This is the serrated and concave part for your thumb to rest on it, because it gives better grip of thumb when placed on it and prevents slipping. Also directs and control the force applied. Biomechanically, it shortens the effective label R by acting as a fulcrum between the handle and the tip. So the length of the handle, thumb, rest to sharp end, and is always 3:1 to give better mechanical advantage. And the other one is sharp beveled area, where it is applied to the bone to strip of the periosteum, and the curvature adjusts to the rounded contour of the bone. Now periosteum is this, you can see the bone in bone anatomy. This is the periosteum which we strip off for any surgery or something. And safety rule, you should remember that always keep the blade in contact with bone, avoid vessel and nerve injury. So you have to keep always on the bone side. And why it is necessary to strip and elevate the periosteum in orthopedic surgery? Because periosteum is a tough and slippery structure, intimately encasing the bone. Thus, any instrument applied over the periosteum will tend to slip, and procedure like bone cutting and drilling will be very difficult. And also, the periosteum, along with the adjacent soft tissue, is held apart by bone lever. Bone lever, you can see this is the instrument of bone lever. At the end, I have given bone lever away from the bone. Using any instrument becomes safer because nerve, blood vessel, muscle, tendon are retracted away from the operative zone. Now stripping the periosteum and elevating it along with the adjacent soft tissue helps it easier reduction to displaced fracture and reduction displaced fracture, and to restore the normal anatomically bony continuity. Now the instrument which should be used before and after the periosteum elevator is scalpel blade, which is used to cut the periosteum before the periosteum elevator is in insinuated to in between the bone and the periosteum. Now the bone lever is also used after stripping the periosteum to hold the periosteum along with the soft tissue attachments away from the bone. And where the periosteum elevator should not be used, it should not be used in operating of patella, that is uh, uh, before the knee bone, that is patella. It should not be used in patelloctomy, TBW, tension band wearing, and also in the excision biopsy of exostosis. And exostosis is nothing but the bony growth. You can see I have given a example of the foot where the bony growth is there. So it is called as exostosis. There is extra bone growth. And also it should not be used in excision of osteochondroma. Osteochondroma, as you know, I have given an X-ray picture here. Osteochondroma is a cartilage overgrowth of bone that happens at the end of the bone near the growth plate. I have given here, you can see here, that is osteochondroma. It should not be used. And as you know, this instrument needs to be sterilized, and in sterilization you should use autoclave for sterilization. This PPT or PDF I will be uploading in AIM4PG Telegram group, also in WhatsApp group. WhatsApp group I will be posting in the YouTube link. Also I will be uploading in aim4pg.com/PDF. So join the WhatsApp group for more details and more PDF, PPTs, notes and images. Thank you. I will be back with next instrument of orthopedic.